is true that the nurses have waited for this CPF for more than 10 years. We have agreed more than 4 times and it's changed. We agreed it's changed. But at long last, we have a collective bargaining agreement that will serve as a foundation for the future engagement. As a nurses union, we have resolved to engage our employers, both in public and private sector, through the law and specifically putting forward the issue of dialogue.
We shall endeavor to deliver on our part as a government. Our request, therefore, is to the union to urge their members to continue dedicating themselves to delivery of service at this very critical juncture where we are implementing universal healthcare coverage.
So I want to ask my dear brother, Panyako, that the same patience that has seen him go through this and agree with us is the same kind of issue that we would want to continue working together.